Myself, I am Dr. Puneet Girdhar and I am heading the spine surgery department at BLK-MAX Super Speciality Hospital, New Delhi. Robotic spinal surgery is a little different from the use of robotics in the other fields of medicine. Like in prostate surgery, head and neck or abdomen surgery, robotics have been used for more than a decade and allows the surgeon to use precise dissection as well as reach the inaccessible areas with good illumination and magnification. It works on the master-slave technique whereby the surgeon is sitting on the console and the surgery is performed with the help of robotic arms. In the use of robotics in spinal surgery, it is a little different. Spinal surgery, as we know, entails a lot of implantation, especially whereby we use spinal stabilization or spinal deformity correction as a technique to provide relief to the patient. The use of robotic in spinal surgery is a little different. This implantation is fraught with its inherent risks of misplacement of those implants or screws, whereby there is a risk of injuring a blood vessel or a spinal nerve during the process of insertion of these screws. The robotics allows us near 100% accuracy and precision in implantation of this hardware. How it does that is something that I would like to explain you in this video. The robotics is actually a navigation platform with a rigid fixed arm which allows us execution of the entire procedure of implantation without any fatigue, without any tremors, and as I said, in a rigid trajectory as designed on the software. So what happens is that the patient is subject to a CT scan prior to the procedure, and this CT scan images are then ported into the robotic software, whereby the surgeon can design the implantation based on the length, depth, the diameter and the entry point as well as the trajectory of the spinal implants on the software itself. It can be either done before the start of the surgery in the operation theatre on the robotic screen, or it can be done days or hours in advance sitting on a laptop in the surgeon's office itself. After having planned, the patient is taken to the theatre on the day of surgery, whereby a new image is taken with the help of a C-arm, and these images are then matched with the pre-operative planned CT scan. Once the images have been approved by the surgeon for a good overlap, the patient is then subjected to the robotic procedure. How does that happen? The robot is brought into action based on the designed trajectory for each screw. Once the robot is given the command for a specific screw level on either side, the robotic arm comes into action and the surgeon can then use that very trajectory through the robotic arm to insert its implant in the precise location to the accuracy of less than 1 mm. Once all the implantation has been done, the robot can be taken out of action and the microscopic work can then be done, and final alignment can then be designed at the end of the surgery.